everyone, and welcome to today's session. I see my camera was off as well. Um, yes, welcome to another installment of our Global Parenting Initiative webinar series. And I am Genevieve Halptrani. I'm the Community of Practice Lead for GPI, and I have the honor of chairing the session today. Before we get started, I just want to highlight a few housekeeping points. So please note that this event is being recorded and it will be made publicly available. You can just follow, you can go onto our website and you'll find it over there. And then to avoid any disruptions, only the speakers, cameras, and microphones will be active in the session. We'll allow some time at the end, hopefully, for Q&A session, but also note that there's a Q&A box either at the top or at the bottom of your screen. Please use this to submit any questions as the presentation goes ahead, and some of the speakers will try and respond to those during the presentation, but we'll also try and keep some time at the end of the session. So I'd like to just give our speakers a warm welcome, and maybe they could just turn their cameras on as I do this. Today we have with us Alessandra Guedes, Lina De Golo, Aditi Leftoff, and Claudia Aleman, and Beatrice Agutu. And as you can see from the slide, that they are based at various institutions and they hold various roles. But today they make up some of the members of the affinity group who are dedicated to evaluating the importance of gender-transformative parenting in the fight against family violence. And as we know, with UNICEF's Child Protection Strategy 2021 to 2030, there has been this fundamental shift in the approach to violence prevention. And in today's webinar, the team will highlight the role of parenting programs and how that aids in the prevention of violence against women and violence against children. And as many of you are aware, this is one of the key focus areas within GPI, and there are a number of studies that have the same focus as well. So I'm going to hand it over to Claudia now. I think you just have to unmute and you can kick us off.
Hi, everyone. I think it's actually me kicking off. So hopefully you can hear me okay and you can see me okay. Thank you so much for joining. And my role today is brief. I'm just going to give you a little bit of a background about how we came together under this umbrella called the Affinity Group. And as we heard already over the last several years, there's been a surge in both the evidence about the way in which violence against children and violence against women connect, and as a consequence of that, an increased interest in figuring out interventions and policies that can simultaneously address both forms of violence. So all of us, I sit at UNICEF's Office of Research in Ocenti. We've got colleagues from the Prevention Collaborative and colleagues from Equimundo, and separately we were fielding different kinds of requests from those who were interested in looking at parenting interventions and caregiver support as one intervention that could perhaps simultaneously address violence against children and violence against women. And so the beautiful photo that you see is from last year's SVRI forum, where we got together and we decided to look in more depth and in coordination at this issue to try to get a sense of what the evidence was in support of parenting interventions as a way to simultaneously address both forms of violence against children and against women. And you will hear more about that process today, and you'll also hear more about some exciting publications and tools that we have coming forward. And I'm realizing that I didn't take control of the slide, but I will now so that I can move to the next slide. I just wanted to mention that for UNICEF, this happened at a time when our new child protection policy was coming into place, and that goes from 2021 to 2030. And it reflects a change in how we approach child protection. And the change that we are proposing focuses on three main characteristics. One, a greater emphasis on the prevention of violence against children. A second one is of greater focus on looking at the social behavior drivers behind violence, and specifically we are trying to figure out in our policies and programs how to look at both violence against children and violence against women in a coordinated way. And that's where this work fits in. So I think I'm handing it over to Lina now. Is that right?
Lena, you're muted.
Yeah, daily struggle. Thank you, Alessandra, for the brief introduction. I'm also going to take just a few minutes to take us through a few slides. I thought I took control. Why isn't this working? What happened?
It should be working now, Lina, if you just click on
slides.
the screen.
I think the slides just jumped off because I think maybe Alexander, you closed instead of going. But there we go. Not then someone else must have closed it.
Mm.
Are you able to do it now?
Yes, but I have many. Are you seeing my screen? I'm seeing many things on the screen right now. Sorry.
Lina, I can do the slides for you. Would that be helpful?
Yeah, that would be helpful.
Okay, so I'm taking control and I'm moving it forward. Let's see.
Okay. No, so I can't see the screen now. Sorry. I don't know what's happening.
That's weird.
Let me try and take control. Sorry, everyone.
No problem.
Is there someone else controlling the screen? Sorry, this is not working for me. Maybe someone else do it.
Let me try again. So I have it now. Can you see it?
Yes.
Okay, perfect. So is it slide 6 that you need me to be on?
Yes, this is the section. I'll just tell you when to move. Thanks so much. So I'll be using a few minutes just to make a case for why parenting programs should reduce violence against women and violence against children. And I think just looking at the participants list, I'm probably preaching to the converted, but really this is just to continue the conversation and also to set a stage for Ruti, who will come in next and just give us examples of how this has worked in the parenting space. Next slide. So we all know that children require and need a nurturing relationship with one or more parents or caregivers for them to survive and thrive. And we also know that despite this, many children are living and growing up in households or in homes where violence is in existence. Particularly the two most common forms of violence that we know against women and children are intimate partner violence and harsh discipline that mostly occur within the home setting. And we also know that violence has really severe and dire consequences for both women and children, with children, it affecting their health, development, and well-being, and for women, really affecting their social, economic, and health status, and also their capacity to connect with the children and to give them that nurturing care that we just spoke about. Next slide. So there's continuous growing data showing us that these two forms of violence occur together and mainly occur within the same home. And we also have a number of studies, including from people in this group, which are now showing that you could actually program for these two forms of violence together. And the data that's really driving this conversation we're having together here was data that came out showing that the two forms of violence actually intersect in various ways. Apart from the co-occurrence in the home, the two share common risk factors. For example, within the family, having conflict, marital conflict, family disintegration, and things like economic stress in the household really drives both forms of violence, or either of the parents abusing a substance of abuse that could also drive. So there are many examples of risk factors that these two co-share. We know that we have social norms, harmful social norms that drive the two, and good examples, a few examples I can give are norms such as those that condone violence, those that support gender inequality or blame the victim, or even drive or discourage help seeking. for both women and their children. So these kind of similarities, again, are the reasons why we are starting to talk about should be programmed together. There are other aspects that show this overlap, like they both have the intergenerational effects of violence. We now know that there's data now showing that children witnessing violence in childhood or actually experiencing violence itself can increase their risk of violence in adolescence, and for girls actually increase their risk for violence later in life, and for boys increasing their risk of perpetration. So some of these intersections, and we could talk about them for long, but for the purpose of today, I would like to summarize that there are numerous ways that these two intersect, making a case for working at the intersection of both violence against women and violence against children. And we can give you more reading on that to get more information. Next slide. So I also wanted to highlight that we also have gender norms that drive, harmful gender norms that actually drive these two forms of violence, but also that can shape how parenting practices occur. And just to give you one or two examples, are like a gender norm like those that discourage men in participation in caregiving, and therefore children missing out from that, good parenting from their fathers or their male caregivers, those that contribute to unequal dynamics within the family, sort of like men having to be the decision makers or women having to be the sole caregivers, again, influencing or driving the two forms of violence, but also influencing how parenting occurs. Next slide. So just keep that in mind. So with that in mind, I hope you're convinced that working at the intersection of both forms of violence there's evidence for that, and there's a need. And again, as I said, many of us in this group are already producing that evidence from GPI studies that's actually also pushing for the same agenda. But right now, what I'd like to really talk about is the parenting program as a platform for violence. I've just shown you on screen two frameworks from WHO, the Respect Framework and Inspire Framework, which are now the frameworks that are being used in wide scale for preventing violence against women and violence against children. And both frameworks actually highlight working with parents and caregivers as a strategy for reducing both violence against women and violence against children. Apart from that, we have growing and continuous evidence that's showing us that it's actually possible to reduce both through parenting programs. And despite this growth of evidence, there's still limited programs working at the intersection of violence against women and violence against children. And we think this is actually a missed opportunity. There's ways you could actually incorporate components that really look to reduce both, and you'll be seeing how. And so we hope that following this session, you'll be able to see how this can be done and consider adding it to your program. I'll now hand over to Ruti to really take us through the evidence, what the evidence says, and also just to show you how different programs have actually worked in terms of reducing violence against women and violence against children that focus on parenting programs. Over to you, Ruti.
Thanks, Lena. Can I ask you to continue with the slides? It might be easier than, does that work? Okay, great. So thanks everyone, it's great to be here. Sorry, next slide. Thank you. So I'm going to talk very briefly about the evidence and then dig a little bit deeper about sort of some of the common elements or principles as well as content that we see across some of the admittedly limited number of programs that are working in this area. So in terms of the evidence, I think the first thing to say is that we do know that both violence against women and violence against children are preventable, and that they're preventable within what we talk about as kind of programmatic timeframes, right? This isn't just a generational change, although there's, of course, some things that do take that long, but our programs can have an impact in a relatively short period of time. And we also, as Lena said, now have evidence that programs can reduce both intimate partner violence. So this is typically violence against women in a relationship, as well as the violent discipline of children at the same time, so within the same home. The evidence comes from different types of programs, including ones that aren't specifically designed to address both forms of violence. So we see, for example, programs that are maybe more couple-oriented, that show impact on violence against children, but then also ones that are focused more on parenting that are starting to show also an impact on intimate partner violence. So again, these are some of the evidence doesn't come from what are traditional parenting programs, but actually ones that are in some ways designed. So there's some evidence from programs that are not designed to address both, as well as evidence that from programs that are. And again, like Lena said, while this evidence is growing, it is still quite limited, and there is lots of opportunity and lots of space for testing, for adaptation, for innovation, and for evaluation. Next slide, please. One of the things that the programs that have been shown to be effective have in common is that they are what we call gender-transformative programs. These are programs that that recognize how gender inequality and restrictive norms reproduce violence, they shape parenting practices and division of labor in the home, and just the environments that children are raised in. And these programs very intentionally aim to address these gender-based inequalities and to challenge or transform harmful norms and power imbalances. And so from a positive perspective, they really promote caring and nonviolent families where both men and women share responsibilities and children are raised equitably. Next slide, please. So these gender transformative programs with parents that are trying to reduce violence, as I mentioned, they differ a little bit in what they look like and their methodology, but they commonly have these sort of principles in common. So as I mentioned, they're gender transformative, so they're grounded in gender equality and women's rights. They typically engage men or fathers alongside mothers, which I think is somewhat unusual for parenting programs that maybe traditionally have really focused on mothers. They tend to use participatory and non-didactic approaches. We all know nobody likes to just be talked at. And so creating an environment that's participatory, that promotes reflection is a really important aspect of this. They tend to take a strengths-based approach. And of course, they promote or kind of pay a lot of attention to women and children's safety and rights. Next slide, please. I wanted to also talk a little bit about the core content that we see across some of these programs. And I also wanted to highlight these because I think a lot of these will also sound familiar to those of you who work on more traditional parenting programs. So, and I hope that we can have a chance to talk a little bit more about this towards the end. I do also want to mention that while we're focusing here on content, it's really important to keep in mind that the fit of programs and the content to the particular context, as well as the implementation of the program, are as essential as the content. And I'll put a resource that we developed in the collaborative in the chat to help think through that a little bit more. So in terms of the content, some of the things we see across, again, are this gender transformative component, so content that promotes particularly reflection on gender norms and power imbalances, content that helps to raise awareness of violence and its consequences, both on the family, but also specifically on children. There are strong skills building components, so building relationship skills for the couple, but also strengthening caregiving and positive parenting skills, as well as supporting parents to develop kind of self-management and emotional management skills, so skills to manage emotions. In addition, programs typically promote more equitable family dynamics, so in particular, more involvement of men in caregiving, but also women's participation in decision-making. They promote healthy relationships with alcohol as as an important risk factor for both violence against women and violence against children. They provide opportunities for parents to think about intergenerational aspects of their parenting and to kind of break harmful intergenerational patterns. And then, of course, especially in programs that are group-based, they try to foster family and peer support to help enable these changes. Again, I think some of these will resonate with kind of more traditional parenting programs as well. So in the last few minutes that I have, I wanted to jump a little bit deeper into a few of these. Next slide, please. So what does it mean to have content that promotes reflection on gender norms? So parenting programs can use activities and group discussions to promote reflection on, for example, how gender norms have shaped parents' behaviors and the expectations that they have both for themselves, for their partners, for their children. They can think about power and how it's used within the family, both, for example, power imbalances between men and women, but also between parents and children. And then really what's been quite powerful is focusing on the costs and disadvantages of adhering to these rigid norms, and on the other side, the benefits of having more respectful, more caring, more loving family and more equal family relationships. Next slide. Raising awareness of violence and its consequences. So again, without posing too much of a sort of blaming or negative lens, highlighting the negative impacts of violence both on women and on children, but also the impact of violence on men and the community more broadly. And then thinking about how social norms and gender norms perpetuate violence against women and children. And importantly, thinking about violence as a behavior that's learned and that can be unlearned, and that we have other strategies to use as well. And just in terms of a safety perspective, these programs also highlight services and resources that can be accessed within the community. Next slide, please. Like I mentioned, building relationship skills. So within the program, creating opportunities for discussion, for shared goal setting, as well as kind of practical exercises to build communication, to build conflict resolution skills, and just have kind of spaces for couples to spend time communicating and thinking about what they would like their families to look like and the benefits of their healthy relationship for the rest of the family and their children. Next slide. And then finally, this slide around promoting equitable family dynamics. And I think a lot of the times we focus on this in terms of encouraging men's participation in childcare and household tasks, which is a really important element of this, but we also need to focus on creating opportunities for reflection, for discussion, for exercises around how to encourage women's participation in decision-making, in kind of creating equity, not just in childcare, but in power relationships within the family. I'm gonna, the last slide, just to conclude very briefly. We don't have a lot of time today, so we're sort of speeding through. But as Lena mentioned, there's considerable opportunities for parenting programs to address both violence against women and violence against children. This is through kind of integrating gender both in the approach and in the content, engaging fathers alongside mothers, and addressing couple relations and intimate partner violence. Gender transformative approaches can help to amplify the impact of these programs, not just on this kind of potentially new outcome of reducing intimate partner violence and kind of improving the family environment, but also on like furthering the impacts on parenting, on relationships between parents and children and child outcomes, because as we know, those are really affected also by the presence of violence against women in the home. And then finally, preventing violence in childhood is really critical to the long-term prevention of both violence against women and violence against children. So we're really addressing a cycle here, and more adaptation, testing, innovation, and evaluation is needed so that we have kind of a wider menu of options to address these topics. I'm now going to pass it on to my colleagues Clara Aleman and Beatrice Ugutu to talk a little bit about how we put this into practice. Thanks, everyone.
Thank you so much, Ruthie, and I'm really delighted to introduce you to Beatrice Ugutu, Executive Director from ICS, Investing in Children and Their Societies organization. And welcome, Beatrice. I'm delighted. Such a pleasure to be together again, having this conversation about the journey of putting into practice a lot of the ideas that Lena and Ruthie introduced us before with the Skillful Parenting Program. So just briefly for context, for those that are listening and might not be familiar with ICS and the program, addressing violence against children was already part of ICS's core mission, right? To create nurturing and safe environments for children and their families. And you had developed, implemented, and evaluated Skillful Parenting, a curriculum that was already dedicated for parents, caregivers of children aged 0 to 18, to promote positive parenting practices and mostly reduce violence against children and promoting children's positive development. And several evaluations found it was effective in improving positive parenting skills, in reducing the use of violent discipline, and also contributing to better relationships among parents. In 2019, so like 3 years ago, ICS initiated this learning partnership with the Prevention Collaborative to strengthen the parenting program, to do exactly what Lena and Ruthie were discussing before, to intentionally promote gender equitable relationships and prevent both intimate partner violence and better address the common risk factors of violence against children, which the program was already aiming at. The result of this collaboration, 2+ years later, is now a gender transformative, skillful parenting curriculum that was redesigned to effectively prevent the co-occurrence of violence against children and intimate partner violence and promoting children's positive development. It has recently also been adopted by the government of Kenya to be taken to scale as part of their national positive parenting program. So it's a real journey and success and there's so much experience to share. So I would like us to start by discussing or hearing from you of what led you to take the decision of integrating these approaches and a gender transformative lens and content into the Skillful Parenting Program.
Thank you, Clara. Thank you, colleagues. Happy to share our experiences. It sounds really, brief, but it was a journey of transformation that took us close to 2 years, working together with the Prevention Collaborative to critically interrogate the program approach that we had developed several years back that showed great promise in addressing violence against children and promoting positive parenting practices, But for us, because family is a great entry point in our programming, there was a missed opportunity to address violence against women within the family setup. And therefore, during our evaluations, we saw and experienced some anecdotal evidence that indicated that there is great potential, but we didn't necessarily know how to go about it. So we did invite Prevention Collaborative, and we understood from the beginning that this was not a one-off training engagement that would enable us, reflect back, synthesize, and add new content into our curriculum. But it was basically starting to interrogate this journey right from the theory of change. What are the drivers of violence? How was our approach addressing issues around violence against children? And what are the missed opportunities that we had in addressing intimate partner violence within the household setting? And how then can we strengthen it to also address and articulate actual norms change, to address the drivers of violence? So it was a journey that started with internal reflections that took quite some time because we were challenging our value systems as individual staff members, but also collectively as a team, because we are a product of our same environment, So some of these discussions that we had initially with the Prevention Collaborative team was also to help us challenge our own perspectives about gender norms, social norms that were in our environment, but also our understanding of what gender transformative approaches mean. Because this word is so loaded in our context as practitioners, and there's a lot of definitions out there of what gender transformative approach. So unpacking this was quite crucial for us as a team before we embarked on a process of co-creating, developing content together. And as I've said, it was not about developing or adding new modules into our program manual. It was more of, interrogating each particular content, trying to repackage it from a gender lens, and ensuring that we have participatory reflection actions that then would help us engage together with the families to address these issues that have been there. But 2 years of internal learning and learning, transformation, developing a new curriculum from a gender lens, piloting that to see whether it makes sense with us as the facilitators of the program, but also the community members with whom we were serving with this particular program. So yes, and the benefits have been enormous in that sense, because then one, as I've said, the missed opportunity when we got into families, yes, we were addressing violence against children, but the women and the older girls in those families were suffering, and there was no solution we were offering at that point. So this is actually a great place for us to start and continue to address both forms of violence within the family, and it has really yielded a lot of benefits. In addition to that, it has also strengthened outcomes around positive child development, looking at it from a gendered lens. And then it has also provided us a better foundation to be able to strengthen male engagement alongside women within the family environment. So we see great benefits. And as we bring it to scale through government, these are some of the benefits that the countries will reap. Yes. Over to you, Clara.
Wow. So much in a nutshell, but yeah, a lot of highlights there of what the process involved, and yeah, your commitment and the benefits that you're already seeing. So if you could highlight the biggest lesson that you learned and that you would like to share with others who are interested to do the same, what would it be?
Thank you, Clara. Institutional learning and institutionalizing the new program takes time. And you need somebody to handhold you, walk with you through the process, and help you navigate the challenges, because this is a program we've been implementing for the last 8 years. So comes a new version that is gender transformative, bringing your team to get to understand what the program is all about, and teaching them how to facilitate it in a new way that they were not used to, took time. So for organizations that are willing to adapt and reach their parenting programs, they need to be patient. They have to have a technical partner walk with them the journey. It's not as easy as introducing new components. It's about interrogating each and every component and developing it or enriching it from a gender transformative lens. It's about testing it and trying it out again with the communities that you're working together with. So 2 years later, we can confidently say. So it's a journey that requires time commitment from the leadership of the organization. You need to invest in developing the capacity of your team to be able to implement this new approach and check it, evaluate it, resource financing to be able to evaluate this new approach, to be able to enable you gather sufficient evidence. It's also opened a lot of spaces around connecting and collaborating with women rights organizations that, you know, traditionally in our context, violence against women and violence against children have followed, you know, two different trajectories. So it has brought us closer to conversations with, you know, between child rights and, you know, women rights organizations, and seeing those opportunities to be able to work together in the field. Again, it offers greater promise to address those three outcomes you're looking for: positive child development, violence against children, and violence against women. But beyond that, I think it's also the expertise of the partner that you bring on board to be able to walk you through. Prevention collaborative colleagues were patient with us. They came in, learned about the context, learned about what our strengths were, and built on those strengths, and then added new component from other evidence-based interventions. So it's also opening yourselves to learning and picking from others what they've been doing very well across the region. So it's a journey of transformation, not a one-off event. So patience and resources is required, and commitment from organizational leadership to do this.
Thank you so much for more than one lesson. And I hear institutional learning and commitment takes time, leadership from the organization, asking for help from those who know particularly about these approaches, trying resources, dedicating resources, being ready for iterative learning, for interrogation of everything you've been doing so far and what works and what needs to change. And we've been hearing as part of our parenting affinity group with the Prevention Collaborative, UNICEF Innocenti, and Equimundo, a growing interest from lots of practitioners like ICS in integrating these approaches in navigating this journey that you've done with so much commitment. But there's a dearth of resources to support practitioners. So I don't know if somebody could put the next slide, because I wanted to very briefly share 4 resources that we've developed and that hopefully we'll be able to share very soon, beginning of next year, to all those parenting practitioners interested in learning more about how to put this into practice. And so there's 4 resources. One is about making the case, right? Is why is it important that parenting programs don't waste this unique opportunity to address both intimate partner violence as well as violence against children, and promote more gender equitable and caring relationships as they do that. The second is, what do these gender transformative programs, or these effective programs in doing this, look like? What are its core ingredients and elements? And the third one is, how can programs, maybe more traditional parenting programs, be adapted to address both types of violence? And it provides step-by-step recommendations for practitioners on how to exactly do this, with a lot of useful resources. The fourth resource is about how can change be measured. So depending what the program is actually seeking to achieve and measure, what are some tools and questions and processes in order to do that. So we invite you also, if you help me with the next slide, for those interested in receiving these resources, we have a QR code in the next slide that, if you can scan it, this will put you together in a list for us to share not only the resources, but invite you to other events with learning events with practitioners in our field. I think we have a little time for questions, and I'm sure there's a lot of questions for our presenters. So I'm going to stop for now there. And Genevieve, I don't know, I can't see questions, but I don't know if you can.
I can.
Help
So
us with that.
let me share questions. Thank you so much for the presentations and the speakers. We can open the floor now, but I think we'll start with some of the questions that have been posted in the Q&A. So thanks a lot. This is from Esther. Thanks a lot to all speakers. I have several questions. There is any evidence from parenting programs from West and Central African countries? I'm not sure if it's a comment or question. You were talking about IPV reduction and programs to reduce IPV amongst women. Any program focus on adolescents take into account that in the case of West and Central African countries, we have high levels of child marriage? That was the second question or comment. The third one, this is all from one person. I would like to hear about cultural adaptation of programs. And then the final question from Esther was, is there a link of the parenting programs with other strategies such as social behavior change or strengthening of social service workforce? I think those were the four questions from Esther. So maybe we could take those and then we can move on to the rest. Anybody open to take those? I wonder if it isn't better to stop sharing and then maybe you'll be able to see the Q&A, because it is obviously helpful if you can read the questions again.
I could start with some of these, but hope others can jump in. I wanted to start with the question about adolescence. Adolescence is one of those areas it's really important because adolescents can experience, they're sort of right at the intersection, right? They might be experiencing violence both from parents, but also from intimate partners. They're also often parenting themselves. And so I think it's a population that needs more attention. I think there are some I don't know that the evidence that, that we've kind of compiled, and again, I'm looking at others here to help me if there is something there, specifically around parenting programs for adolescents that show impact on both, but certainly parenting programs for adolescents as well as violence, like IPV prevention programs with adolescents. We have seen impacts there in kind of separate programs. And they often, I will say, have similar components to the ones that we discussed earlier, right? So they're often gender transformative. They often build skills. They do need to take into account the power that adolescent girls may or may not have in the relationships that they're in as well. I don't know if anyone wants to add to that. Okay. Sorry, then the other elements.
I can take.
Go ahead.
Beatrice, go ahead. Beatrice.
Thank you. Not necessarily to add to what Ruti has talked about, but there was a question by Aman Aurora on the chat box around the engagement approach for the parenting programs. In our context in Kenya and Tanzania, we use the parent peer group approach, bringing together men and women and sometimes couples, but it's men and women. They don't have to come as couples, but we are now also trying a new approach of couples. In areas where there is low male engagement, you also have separate sessions for men alone. And when they get the first 4 sessions, they get inspired to join the normal, what we call the normal peer group. But a peer group approach has worked well for us for reflections, participatory actions, and building on each other's strength and providing that support system that they need beyond the formal engagement that they have with us as an organization. There was a question around cultural acceptability. I think one of the aspects that currently in the East Africa region that we are keen about is developing adaptation guidelines, because the content is standard, but contexts are quite different. So when you're working in humanitarian or development context, or you're working with adolescent parents, there are few adaptation considerations, and not all organizations who want to scale up an approach by others have that guidance, or even the main innovator themselves. So adaptive guidelines are really required to ensure that whichever context the core program is being adapted to, then is able to maintain fidelity to those aspects as well. We did a cultural acceptability survey also in collaboration with the University of Utrecht. That remains quite important, and the tools from that exercise continuously helps us in different contexts to test whether the content and the approach is acceptable in whichever region we are implementing this particular program. But adaptive guidelines are really required, even as government goes with these programs to scale. How they implement and build the capacity of different agents to implement this across different contexts remains quite critical.
And maybe to add on to Beatrice's question on engagement, that was from Aman. I think the different programs. So we have a review, an evidence review that we can post into the chat if it hasn't, where we looked at the different programs and the different approaches that they used. So that would be useful for you to look at. But one of the common things we found was that a number of them actually, and you asked about door-to-door yeah. So basically a number of them had their meetings within the community in a group setting within the community, but later on they could follow up with specific parents or a specific parent with a home visit. So that seemed to be the approach they preferred. But also another common thing for those that were parenting programs designed as parenting programs initially, they would have meetings where they'd have the parents separate first. I think that was mainly cultural. And then there's some sessions where they brought them together to learn together. So that's a common thing we saw, but having them in groups seemed to be quite beneficial in addition to having those individual sessions.
Maybe I could add a bit on the cultural adaptation. Thank you, Vasil, for adding that. So there's a lot of elements or layers on the aspect of not only design and implementation, right? So of course, we want to really understand who is the population that we want to engage. Adolescents were mentioned, so age, gender. If we want to engage fathers, of course, we need to understand that they're not the usual participants engaged by parenting programs. So understanding what their motivations are, what their concerns are around fatherhood, but this is for all parents and caregivers, right? What is their, again, motivation to engage with this, with the parenting programs? What are the social and gender norms that we were speaking about before? What are the drivers of violence in these communities? What are the services available? So that's about the context and the environment. And then in terms of the actual methodologies, activities, of course, we need to ensure that the language and the content culturally resonates with participants. So we usually adapt, and there's a lot of iterative testing and trying and revising, like Beatrice was describing. When we worked with that curriculum, I remember, Beatrice, your team testing some of the methodologies that had been like adapted in gazillion countries, but they did it their own way. They decided to do some adaptations that worked better in the communities that you were going to deliver this program. So that iterative learning is can only be tested and done and really see what resonates with the communities that for which this program is intended. And then, of course, determining who will facilitate the programs, who are the profiles of people that parents in these communities trust and would see as legitimate to be facilitators of these programs, and who can also sustainably be implementing these kind of programs. So I would say those are a few elements that we took into consideration and that we would recommend for other programs adapting gender transformative parenting programs.
Thank you, Claudia. There's just a few more questions and I think we have some time to get to. Leanne, the question was posed: violence against women seems more deeply entrenched and more challenging to combat than violence against children. What are some of the examples of best practices to frame such a program to include likelihood or acceptability engagement on the part of partners or fathers? Ruti, you were nodding your head, so I'm going to hand over to you. And maybe there's a few others on the call that would like to respond.
Sure, I can start, and I'm actually curious to hear people's opinions here. I feel like they're both really quite deeply entrenched. So the idea of disciplining children and kind of keeping them in line, I think is actually very, very difficult to kind of an idea to dislodge. In terms of how do you kind of engage people, I think in general, for these types of programs, we don't frame them as these, especially when they're framed towards men, we don't typically frame them as these are programs about violence, these are programs to stop you from using violence. We typically try to emphasize the benefits of such programs. So you frame it as a program to strengthen family relationships, to to kind of create in a lot of the settings that I worked in, the idea of a kind of harmonious family really resonated. And so you sort of come in with that positive aspirational framing, and you try to make these topics relevant to the participants, right? So many fathers can connect with the negative experiences that they had of violence as children, as adolescents, and kind of try to think about how they might want to do things differently. And I'll stop there and see if others want to add to that.
Sure, I agree with you, Ruti, on so many levels, and following through on what Lina presented earlier, the core currents, the risk factors being the same, and both being deeply entrenched, the framing around your violence prevention programming without necessarily narrowing down to violence against women or children, because family being the entry, you're dealing with the family dynamics and the power balances there. So I think even in the choice of how you sequence your modules in your curriculum also matters a lot in that aspect. I remember we proactively made the choice not to start with issues around children, but issues around family relationships and how you can be able to strengthen that before you actually go ahead to talk about we need to understand violence against children and how it affects children. So how you sequence your conversations and where you start from, you're dealing with a whole family issue and not particularly against women or children, because even in our context, when you start talking to men about violence against women, I mean, a backlash, you already experience it from the word go. So how you sequence your conversations through the modules also matters a lot. And we actively start with those that strengthen relationships, help them to build confidence around talking and communicating with each other. And then those other sensitive topics, then come a bit later in the conversation process. So it's really how you sequence, how you enter, and how you promote a conversational approach around some of these issues, that they're both deeply entrenched within the family. So framing is important in that context.
Just one additional building on what you've both said, but the entry point and understanding, that's why I was mentioning in doing formative research and understanding what parents and fathers, because the question is about how to frame it and engage with partners and fathers, what are really their concerns around parenting, family relationships, what is the vision and what do they want for their children, right? Because that is usually what then is used as a framing for what will they obtain through this program of family strengthening, improving the quality of relationships, both couple relationships and with their children. In one of the recent countries we worked, for example, male fathers were really said, I want to be a friend of my kid. I want to just have this close emotional connection. And in other countries, we hear other things. But in this country, this became really the way to frame the way we engage fathers in this fatherhood program. So again, insist, and this is linked to the cultural adaptation, is really hear what fathers, mothers, caregivers want and need. And of course, not promise what the parenting program is not doing, but I think there's always motivations that have to do with giving my children a better future, making sure that my children are successful in different ways, in different contexts. So that's what then the program can emphasize in the as an entry point. And in order to respond to what they're already looking for. And Genevieve, I think we need to hand it over back to you.
Can I come in just, Genevieve, is it okay
Yes,
for me to
please.
just mention two things?
Please go ahead. Yeah.
So 2 points that are not directly related to the discussion that we're having now, but I really like, Beatrice, your emphasis on evaluation and monitoring the outcome, because at a minimum, we don't want to be doing any harm. And we know that these areas are very sensitive. And I appreciate you talking about a partnership with an academic institutions. I think oftentimes those of us who are implementing programs may not necessarily have this skill set for an evaluation, but that's a perfect moment to partner. And the other point that I wanted to mention, we've talked a lot about shared risk factors and co-occurrence. Oftentimes, parenting programs are aimed to improve outcomes for children, whether it's early childhood development or violence. And I think it's really important for us to remember that children's exposure to violence against their mothers indirectly, the evidence is very clear that that kind of exposure has even more dire consequences than when children experience violence directly. So yes, it is about changing norms and about addressing both forms of violence, but even if you were not interested in that, which I'm sure it's not the case for anybody in this call, your own program, if you were to focus only on violence against children, the impact of your out program could be diminished if you're not addressing what's happening to other members in the household, in this case, mothers. And I think it's really important for us to remember that.
Thank you. We're coming up to the end of the session, but there are a few more questions, and I'm not sure if the team is able to stay on maybe for a couple more minutes, and we can try and answer those questions. While people are jumping off, they might come back to the recording and actually be able to access your answers to some of the questions that were posed. So just for another 5 minutes, I think we could just stay on and answer some of those if possible. As Claude is pulling her face, she might have to jump off. That's fine. That's fine. As soon as you need to jump off, please go ahead. But I think maybe just answer 1 or 2 more questions. Let me just have a look here. Andy Hill, what does the evidence say about the importance of addressing family economics, both as part of the parenting program content or as the complementary activity or program component? I know you mentioned something around economics and yeah.
Beatrice, would you like to talk about ICS experience with that?
Yes, thank you. In all our contexts, as much as possible, we combine the parenting program, the Skillful Parenting Program, with economic support interventions, given that, of course, poverty is a big stressor in the parenting process, and it's also a risk factor for violence. And when we did so, we saw a great opportunity, one, to increase male involvement, because most economic interventions tend to attract more men. So in that sense, we also benefited from, bringing more men into the parenting space and having those conversations. And in actual sense, they also facilitated discussions around money, which is a sensitive topic between the couples themselves. So it created that platform where they could safely talk about money, plan for these resources, and be able. So yes, there are great benefits of combining the two, because the risk factors that are associated with vulnerability and poverty, to be specific, can water down, discount some of the benefits that you already see in parenting programs. So it makes a lot of sense to combine them when there's that possibility to be able to do so. It has benefits of bringing more men on board, addressing economic stability within the family, and enabling the family to plan well within the resource base that they already have. But it requires meticulous programming and sequencing. So which one comes first? It depends on which is the agency in that particular context. There are places where if you're not addressing food, immediate basic needs, it doesn't matter what other conversations you can have, because they'll not come anyway. So you need to have that cultural lens and contextual lens to know, if I start with an economic intervention, then it's going to be a good foundation to start on the conversations around gender transformative parenting. But there's some places that it's a bit easier to start off with the parenting discussions and then move ahead to economics. So it depends on context as well. But it has great benefits to combine and pull them together in so many ways that we have experienced in Kenya, Tanzania, and Cote d'Ivoire. Yeah.
Thank you. 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 T Thank you for that. If there's no other responses from the speakers, another question, I know Erika's jumped off, and I'm not sure if Ruti shared some of this because I know you were sharing some things in the chat. The question around app is it not, oh, sorry. I would appreciate any evidence and references to the involvement of fathers, in particular children between the ages of 2 and 6, have led to prevention of both forms of violence. So I'm not sure if you shared anything to that effect, or if you have anything like that available. Could people just go onto your website or the other links that people could follow? Okay, perfect. Let's see.
Yeah, I think there's one link above, which is core elements of effective fatherhood programs to prevent violence against both, which is not exactly children 2 to 6, but a range of children from 0 to, I would say, adolescence. Yeah.
Okay, perfect. And I think this might be the last question if I haven't missed anything. So violence against women, no, we've done that one. We've done Esther. We've done that one. We've done Aman. We've done Andy. We might have actually covered all. Let me just check in the chat again. Yeah, I think we might have covered everything. Hopefully we haven't missed anything, but if we have, I'm sure there's one from Isang as well. I don't think this was addressed. Thanks so much for the presentation. In addition to framing this as a program that strengthens family relationships, I was wondering if there has been cases where the framing included children's educational attainment. Yeah.
Not yet from our contexts. We are currently looking at adapting the parenting program in an early childhood care and development context, where we are looking to promote opportunities for early learning in addition to responsive caregiving. So it would be an interesting space to watch out for. We are learning as we are doing it, and we'll be able to share some of the resources later on as the program matures.
Perfect. I think that's all. I'd just like to thank our speakers again and for staying on an extra 5 minutes as well, and all those who've stayed on also just to hear the final Q&A responses. Yeah, thanks again. This is such a valuable topic. I know everybody's really interested, and also the intersections as well as the gender transformative way of looking at these programs as well. So we definitely will be following to get more of your resources and any other work that comes out from your group, and we would hope to have you back at some point as well. Thank you so much and take care.
Thank you,
Thank you
Genevieve,
very
and the
much.
whole
Thank
Beatrice
everyone.
and
Thank
the
you.
whole
Thanks, everyone.
initiative. Bye. A pleasure.
Bye.
Have a good day.
Thank you. Bye.